Subscribe to our channel, and hit the bell icon, to never miss a video from us. Hi everyone, welcome to Test Prep Training. In this video you will learn about the top interview questions for Certified Coding Specialist. So let's get started. Question number 1, what is clinical coding? Your answer is: clinical coding or clinical coding is the calling of dissecting a patient clinical assertion, and making an interpretation of them into standard codes indicated in the grouping framework. Insurance agencies utilize the made-in interpretation of the archive to process and repay their cases. Government, medical services associations, and exploration associations utilize the information for studies and examination. Question number 2, what are you familiar with ICD codes? Your answer is: ICD code or International Measurable Characterization of Infection is an arrangement of codes that was laid out by the WHO to portray the reasons for injury, ailment, and passings. ICD codes are 5 to 7 person alphanumeric codes starting with an alpha person. The ICD has two parts. 1. Clinical change code for indicative coding. 2. Procedure coding framework for long-term system performed. Question number 3, what are HCPS codes? Your answer is: Healthcare Common Procedure Coding System has 3 levels. First, Level 1 are 5-digit numbers kept up with by the American Medical Association. The code includes CPT codes to distinguish the clinical benefits, or methodology requested by the doctor or authorized clinical expert. Second, Level 2 are 4-person alphanumeric codes containing 1 letter set and 4 numbers in the code. We utilize these codes to recognize the items, drug stores, and administrations not utilized in Captain. Third, Level 3 codes are 5-person alphanumeric codes starting with W, X, Y, or Z utilized when Level 1 and 2 are inaccessible to indicate a specific action or determination. Question number 4, when are HCPS modifiers utilized? Your answer is: HCPS modifiers are utilized by coders when we need to give additional data about assistance or system performed on a patient. We utilize the codes to determine: 1. Indicate the region of the body. 2. On the off chance that the specialists played out different systems in a similar visit. 3. The justification for ceasing treatment. Question number 5, what are DRG codes? Your answer is: DRG codes represent diagnostic-related gatherings. This framework orders medical clinic cases into 500 set gatherings. DRG codes are utilized uniquely for ongoing cases from the hour of admission to the hour of release. Numerous insurance agencies pay simply as indicated by these arrangements, and the coder needs to hit the nail on the head. Question number 6, what clinical code sets would you say you know about and are prepared to utilize? Your answer is: the inquiry lets the questioner what phrasing you know about utilizing clinical codes, or whether you will require additional preparation. I know about the CPT and HCPS, and have been involved in these codes previously. I'm at present chipping away at CPT. Question number 7, what is the distinction between ICD and CPT coding? Your answer is: the ICD is a universally perceived worldwide coding framework planned by the WHO for diagnosing and depicting ailments, while we utilize the CPT or current procedural terminology coding for detailing clinical benefits and methods, for example, indicative, research facility, radiology, and medical procedure. CPT portrays the techniques and clinical benefits done by the doctor or clinical expert. Question number 8, what is your perspective about Endeavor Constant Preparation Open Doors? Your answer is: organizations need to employ up-and-comers with a disposition toward learning. The medical care framework is dynamic with new strategies, illnesses, therapies coming. The patterns in the medication continue to change. It is vital to hold a significant psyche to these changes. Question number 9, what are the normal charging blunders in clinical coding, and how would you forestall them? Your answer is: the most widely recognized blunder is excluding adequate data for insurance agencies to deal with the case, or unintentionally entering incorrectly expenses or codes. I normally twofold really take a look at my entrances against the patient document. I ask the doctor for any explanation in the event that I notice missing subtleties or confounding passages. Question number 10, what technique do you use to guarantee you enter the information rapidly and accurately? Your answer is: while entering clinical information, I get into a cadence of composing the numbers while perusing the patient records while entering the underlying information. I audit my work prior to submitting, pointing at significant patient information on the document, and featuring the information with my mouse to guarantee they match. Question number 11. What are the strategies for getting sorted out bill installments? Your answer is: my present office utilizes an advanced bill paying entry. We additionally keep a reinforcement paper framework for patient records, assuming there is an issue with the computerized framework. Question number 12. How might you disclose charging codes to a confounded patient? Your answer is: I realize clinics can be upsetting for the patient. I will move toward the patient with compassion. I will audit and affirm the techniques that were completed. I would list the codes with the relating technique. I would pose the patient had some other inquiries. Question number 13. What are the 3 ways to organize bill paying? Your answer is: 1. Paper. 2. Organizer or binder. 3. Computerized bill paying. Question number 14. What are the types of medical billing coding systems specific to healthcare? Your answer is: 1. Indicative codes. 2. Drug codes. 3. Geographical codes. These are kinds of clinical coding. Indicative codes are utilized to decide to expire, drug codes are utilized for distinguishing meds. Clinical coders will change over the notes of doctors into proper codes. Question number 15. What is your take on medical billing future? Your answer is: with the approach of medical services change, many individuals are investigating clinical charging professions. The Occupational Outlook Handbook says this vocation field is relied upon to develop through 2018, and that implies a strong and stable professional decision. The extraordinary thing about most clinical vocations is that they stay consistent in any event, during a monetary slump. Clinical billers take the coded clinical record and bill the insurance agency. Clinical billers work in specialists' workplaces, facilities, and medical clinics. It is feasible for a clinical biller to work at home too. Assuming you appreciate working before a PC, information passage, and staying aware of the most recent medical coverage rules and guidelines, then, at that point, this would be an incredible vocation decision for you. For more such videos, subscribe to our channel.